Allergies are one of the most common chronic diseases. An allergy is an abnormal reaction to a harmless substance called an allergen. Allergies, air conditions, and atopic diseases collectively impact millions globally, posing unique challenges to health and well-being. We often take these in our stride and ignore the root of the problem. Shouldn't patients be able to participate in decisions regarding their treatment? What is a checklist to start a conversation with your doctor? How can we better use our voice to demand global standards, like increasing air quality by reducing pollution? Well, there is hope in the form of an organization called GAAPP, GAAPP. It's called Global Allergy and Airways Patient Platform. This is a non-profit organization based in Vienna, Austria. GAAPP raises global quality standards for access to treatment, diagnosis, and care. They currently have over 70 member organizations from all continents, and they have signed up on the Chezuba platform and have benefited from it. We will talk about that too. I would like to welcome Victor Gascon Moreno, the Vice President of Awareness and Operations of GAAPP. Welcome to the podcast, Victor.
Hi, Tess. Welcome.
Victor, I think half the world's population must be suffering from breathing issues, right? Considering the air quality in most parts of the world. So, how did this organization come about, and what exactly does it do?
Yeah, so I think first we need to talk about the impact of diseases on the human population, because sometimes so there is diseases that are widely covered, like cancer, diabetes, that they have a lot of media attention, but all the diseases that related to breathing, to our lung, our respiratory system, or our skin, they are overlooked. They are considered as minor, and only with COVID they became relevant again to the general public. But so GAAPP, as you say, is a global allergy and airways patient platform. We work with allergic diseases. We also work with airways diseases like asthma, COPD, pulmonary hypertension, cystic fibrosis, etc., and atopic diseases like urticaria, eczema. So altogether, those, if you like, there is like an underlying connection in all those diseases, which is an inflammatory underlying connection. So if you group all of that globally, we have more than 600 million people affected with one or more, or two or three of these chronic conditions. Those people, they're normally, they don't have, we have to speak in general. Obviously, each continent is different, or each region, but there is very poor access to treatment, not only medication, but treatment in a holistic way. There is poor or no access to diagnose in many regions. So this is something that we thought when our founders founded GAAPP back in 2009. So that was what set our mission. So we started with GAAPP. It's an umbrella organization that empowers and supports smaller patient organizations nationally, right? Like the Asthma Canada or the National South African Association for COPD, etc. So our mission is to support those smaller organizations so they can work better nationally. They can improve their outcomes at a national level. So as you say, so we have been growing so fast. As you said at the beginning, when we started, I think what we had in the website is like we are 70. Actually, as of this month, we are 113 organizations in every continent around the world. So we have growing substantially, and COVID, for all the negative things that brought to the world, and all the, in terms of all the people that pass and suffer and still suffering from long COVID. The one good thing, quote unquote good thing that brought to the world is first digitalization of healthcare, which is very important, especially in low middle income countries, to have better access and put that respiratory and airways diseases on the
Right,
news. And,
right, right. More awareness and, of course, more recognition for
yes.
this. So, if I have to ask you, what are the rights of patients with allergies and, these atopic diseases that you're focusing on globally? When you say rights of patients, what comes under this?
So we actually have mapped and published the charter for asthma, COPD, and just now we published urticaria, the charter of rights of the patient. So each disease is different, but basically the rights come to the right to have a
Okay.
to diagnose
Okay.
my disease accurately, the right to have treatment, the right to have treatment after, as a tertiary treatment, not only primary
Okay.
intervention, the right to have access to treatment holistically, the right to not be stigmatized, and basically it's just insisting on the duties of government, healthcare organizations, and society towards the people who live with these conditions. Many of those conditions, sometimes there is that misconception that people with COPD is because they
Mm-hmm.
smoke, and that is true in some percentage, but that's not the only
Mm-hmm.
cause. And we seem to forget like the air quality that is just getting worse globally, and we have areas like India, Southeast Asia. We have very bad
Yeah.
air quality seasonally, or China. I used to live there, so and I felt that impact on myself when I was there. So I think this is we have to insist on governments and national healthcare systems and society, and for those patients to have rights, because it's also a benefit for our
Absolutely. Yeah.
society, right? Like this is World COPD Awareness
Okay.
Month. So we were stating COPD causes 4 point, I think 8 billions to each healthcare system,
Right.
because it's not diagnosed on time, because it's not treated
Yeah.
on time. So actually not paying attention to those diseases and not respecting the rights of those patients, it costs money as well to every taxpayer. So I think it's always a win-win
Right.
situation
True.
to
Yeah.
respect those
So I
rights. Yeah.
also think, Victor, sometimes people just ignore it because it is not something that is life-threatening at the first instance. People tend to overlook it themselves, assuming that, oh, this happens to everybody. Oh, this is just a minor thing. It happens once a month or change of seasons for me. So are you saying that people like me, for example, I am allergic to certain substances. So should I also be aware of finding out what triggers off my allergies, and do I get some kind of support in terms of government help?
Yes, so definitely. So it is very important to know when it comes to allergies. It doesn't matter if it's respiratory or food allergies, which is also very
Prevalent, yes.
overlooked, right? Globally. So it's important to know what are you allergic to. The tests, they are really not so expensive, and they are accessible almost in every country. It's just a matter of the patient having the will and the time. Obviously, sometimes we talk about people who has a nine to
Yes,
five and have a
regarding.
family of six and alive, right? And sometimes even for us, people without children, it's like, when do I go to the doctor? I'm working the whole day, but we have to prioritize
Yes.
ourselves, and then first see if you have an allergy. Do not underestimate, like, I don't know, I'm just coughing sometimes because I think it's pollen. It probably not. It's not. So we have to
Mm,
go to the
mm,
doctor,
mm.
get those tests. Obviously, if you can, and if you can afford it. We are totally conscious that in Europe, I'm based in Vienna, in Europe, and we have a very privileged situation with universal healthcare that doesn't
Right,
happen
right.
almost anywhere else. So we are totally aware of the privilege of having healthcare,
Right.
like free healthcare. But so if you can, it's always important to go and see
What
what
allergic?
are you allergic to, what are your
Right.
triggers. and prevent those triggers, because when it comes to especially respiratory food allergies, they can be life-threatening.
Very true.
You can have like very mild reactions for years, and then suddenly have that one exacerbation or that bring you to the hospital, right? And that escalates in more expenses, more time, and your health just starting that cycle of deterioration. Sorry.
Let's take a break to understand what Chezuba is. Everyone at some point ponders on how this beautiful life can be made more meaningful. Maybe you're a leader trying to enhance your employees' experience at your organization. Or you already work for the community and seek volunteers with state-of-the-art skills to strengthen your nonprofit. Whatever your situation, know that you can make a difference. Chezuba began with this very vision, a vision to facilitate every skill and every passion in the world in meeting a social need. Corporate volunteering has several benefits for both businesses and organizations. In parallel, experienced and enthusiastic volunteers join NGO workers, enabling them to serve the community more effectively. Chezuba offers everyone looking to add purpose and meaning to their lives a chance to connect or volunteer virtually with non-profit organizations from over 100 countries around the world. Visit www.chezuba.net and explore opportunities to find meaning. Chezuba, your platform to do good. And now, back with our guest.
And so, how do you collaborate with governments? Like you say, you are in Vienna, so you are privileged to have certain facilities. But how do you collaborate with governments and healthcare professionals outside of Vienna? And what kind of support does a member organization receive?
So I'm going to start with the last one, because that's our core mission, is to support those patient organizations to act nationally. So we offer very different kinds of supports. We offer from in-kind support, educational, capacity building to those organizations, basically everything they need. Normally, when we talk about patient organizations, it doesn't. There is few of them that they are big organizations with staff. I would say that's 5%. 95% of patient advocacy groups, patient organizations, or NGOs are two people working on the kitchen table after they finish their day job, and so they don't even get a salary or a compensation out of it. So we are talking about very small groups that have very few time. So increasing our capacity is always important for us. Telling like, how can you grow? How can you get that funding to have staff? Or how can you reach that magic point that you can pay a salary to yourself and to your staff, so your organization can professionalize, which is so important. And one of the things that we always offer, and our organizations are very thankful for, is we have a mechanism. It's called the request for project funding, where we can so they can submit projects to GAAPP. And then if the board approves, after we pass all the compliance and all the testing and everything, we can support up to 25% of any budget of the projects, right? So that's to give that little extra help, because normally when an NGO in general plan a project, you have a budget, you never get to 100% of the funding, even if you have donors, right? So we always know that there is like, you reach that 65%, that 80% of the budget. So we don't want those organizations to not conduct the project just because of that. So we are there to give them that last push in the budget. So, and this is one of the things we do. But one of the things that the people appreciate a lot is when we meet. So we have two global events, our annual general meeting and our GAAPP summit, which they rotate the continent and the countries each year. Just that chance to be together, all the organizations, to exchange ideas. So we just did one so now it's 2023. So we did one in Milan in conjunction, in the context of the European Respiratory Society scientific meeting. So we did one for our member organizations, those patient organizations, and we were together for one whole day of capacity building and working together, and just having the time to connect and see and share projects, right? Like, I have this project, you have
Yeah,
a similar,
yeah.
let's just do it. Let's just cross country, cross barriers, and make those alliances so important. There is regions in the world that they're composed of very small countries, or with a very small resources, like the Balkan region, for example, in Europe. And we have seen the value of those small countries teaming up together and making projects and making things happen. Like, together we are stronger than
Absolutely.
alone most of the
That's
time.
brilliant. That's very crucial
And
too.
yeah, and when it comes to, as we say, as I say now, we collaborate with medical societies, not only the European. We collaborate with medical societies in the United States, in Canada, in the Asia Pacific. We just actually came from the Asia Pacific meeting in
Okay.
Singapore only like 2 weeks ago. Maybe that's why I'm still a little bit jet lagged.
Thank you for taking time out.
No, it's my pleasure. So we always try to collaborate with them, not only making joint projects, help them to disseminate, translating that science for the people and for the patients who are not medical. They are not medical professionals. They don't understand
True.
those publications, right? So that's something that we also do. Like, okay, let's like explain this to the public, what this discovery means, right? And we do conference together. We actually have very good relationship with all the scientific societies now. They have been more and more open to participate with patients lately, and I think we can pride ourselves in being part of that
Community.
effort for them to collaborate, to work more
Marvelous.
collaboratively.
Marvelous.
And when it comes to governments, so we have many projects like the IRC, where we work with national healthcare system or policymakers on each country to prioritize, for example, respiratory diseases, right? But we also work with global institutions like WHO, GAAPP, and so the WHO, which is the allergy organization, the global allergy organization, and with other umbrellas. So we do a lot of things. We are a small but mighty team here at
Wonderful.
GAP.
So, coming to the team, GAP's strength is surely its board of directors and staff. Uh, Sometimes things can get challenging. So, how do you stay motivated? Just a couple of.
So sometimes it's challenging because working in an NGO, even though first of all, we always have to acknowledge how privileged and how thankful we all should be to be able to make our working in NGO our living, right? We get salary, we pay our apartment, our food with this, so we should always acknowledge that not everyone working in NGO has that privilege, right, of making, this is my career, this is my source of income, and so just that is already a motivational, right? Because many people who has NGOs, it's like, I work 9 to 5 in Amazon warehouse, and then at 5 I go home and I work in my little NGO for, I don't know, for asthma in Bangladesh, no, or
Yeah.
whatever. That's just an example. So that indeed is a motivation itself. But as you know, like, hours are very long. So our team is all around the world. So we don't have like a traditional 9 to 5. We try to be, you are always on, you're always with the phone. We travel a lot. Sometimes we are in this time zone, sometimes we're in that. So it is very tiring. And we only have like GAP as of today, November 2023, we have only 5
Okay.
staff. Some of them, and not everyone is full time. So because that's the budget that we have for now. And we have grown. We started with
Yeah.
only 2, and now we are 5. But still, as you see, the work is mighty, and sometimes we are so tired and so overworked. But when we see the positive impact that us and
Yeah,
our
it's very
member
positive.
organizations do in each country, is when you realize, this is worth it. When we see like this country has recognized this disease, or this organization has achieved for, I don't know, people with pulmonary hypertension to have access to this medicine so they don't die. That just happened in Ecuador. We all work together for that government to provide that medicine into their social welfare system, and so that's what keeps us motivated. Obviously, it's not everything. We are just a small part on the clock, but seeing how people saving lives, improving quality of life, and seeing people prosper, and I think that's just enough, and a lot of coffee. That helps a lot as well.
And talking of volunteering and giving happiness, deriving happiness, let's talk about Chezuba now. Your organization has availed of the volunteer services offered at Chezuba. How did you find us, and how was your experience?
So we found you. We actually, I don't know if I can say that. So we Google you because we were actually looking for volunteers, and there is few of them, but we found that Chezuba has a lot of diversity in terms of volunteers when we checked on your website, and because it's good to have volunteers that they are in our region, but it's even better to have volunteers that help us in regions where, yeah. So we are global, but at the end of the day, we cannot cover the whole planet. You need to have the cultural spice sometimes, or the cultural incentive to work with other regions. And we can, for example, our two. Can I mention our two volunteers? I mean, not the names, but can I mention? Yeah. So we had two volunteers from Nigeria, actually. And that really helped us a lot because we can call Nigeria and communicate, but those persons, they have that cultural knowledge, right? They know how the country works. They know how they have to talk to people. Small things. How do you talk? What is the level of formality that you should address to a doctor, for example? Stuff like that. It really helps because you don't know what you don't know, right? Even if you're global, each country, each region is, yeah. So that's how we find Chezuba so we choose Chezuba by its diversity, honestly.
Thank you for connecting with us. Thank you for availing of these services, and thank you for this lovely talk today. Obviously, there are many issues to be addressed, and GAAPP is doing its best to mitigate them. So, the great work that you are doing, I wish you success in making this world a better, more breathable place. Fresh air and sunshine are like a reset button for the mind. Here's hoping that we find that in our everyday lives. Thank you.
Thank you very much. I hope we do.